In our fast-paced lives, it is so easy to overlook the subtle signs our bodies give us. We often brush off minor discomforts and skip routine checkups, thinking everything is perfectly fine. But when it comes to certain conditions, overlooking the early warnings can turn into a completely preventable issue into a life-altering crisis. For today's episode of Lifeline, let us talk about cervical cancer and how it's a disease that develops silently over many years but remains one of the most significant health challenges for women. This is Andre Isabel Velasquez, your host for today's episode of Lifeline, where we improve our lives by feeding our minds. To guide us today on the intricacies of cervical cancer, Dr. Jocelyn Zamora Mariano is joining us, an obstetrician, gynecologist, gynecologic oncologist at the UST Hospital.
Today's episode, we will just be asking you questions about the concept of cervical cancer and how us women can also prevent it. So, are you ready po, Doc?
Yes, I am. I'm so excited to talk about it because next month, May, is Cervical Cancer Awareness Month.
All right.
What is cervical cancer and how does it develop?
Okay, so cervical cancer is an abnormal growth in the cervix, which is caused by the human papillomavirus. There are certain types of the human papillomavirus, high-risk types, which may cause the cancer in the cervix.
Why is cervical cancer considered highly preventable compared to other types of cancers?
Cervical cancer takes a long time to develop, so it progresses from a pre-malignant lesion which can transform 15 to 20 years before it develops into cancer. So there's a lot of time for us to be able to screen our patients, work on them so that we can prevent them from developing these pre-malignant lesions into cervical cancer in the future.
What are the risk factors for cervical cancer?
Number one, as I said, the cause of the cancer is the human papillomavirus. So we need to introduce the human papillomavirus into the cervical epithelium. So yun yung part ng cervix.
Yes.
So it happens very early if they have early sexual contact, early sexual debut, if they get pregnant right away, if they have a lot of pregnancies, multiple partners, if they're smoking, if they are using oral contraceptive pills. These are all risk factors for the development of cervical cancer. Having to have a lot of sexual partners, more than 6 ang sabi sa statistics, would mean that you have about 3% chance or 3% relative risk of developing cervical cancer in the future. So it points us to, it puts it into a particular line wherein we can do something about it because we know that these factors are preventable.
So, since it's also preventable, what are the common symptoms naman po for cervical cancer? Like one should look out for?
Okay, the most common symptom is postcoital bleeding, which means every time they have sexual intercourse, there would be some form of bleeding that may happen. Okay, so it can vary from just a spot that's noted after the sexual contact, or sometimes because the tumor is too big already, it can result to having massive bleeding or heavy bleeding after the sexual contact. In some cases, there are cervical masses, which are cervical cancer masses, which grow from within the cervix. So this may not cause bleeding per se during contact, but they may cause abnormal discharge. So yung discharge niya is very, very characteristic of cervical cancer because it has a peculiar scent or stench that will readily identify that this is cervical cancer.
How does cervical cancer differ from other diseases that affect the female reproductive system, like ovarian cancer and PCOS po?
Okay, so cervical cancer, cervix is that part of the uterus which is protruding into the vagina. So this is the one that's usually bothered during sexual contact. So if there's a mass that's there, it gets touched by during sexual penetration, and that causes the bleeding. Ovarian cancer cannot be palpated right away in the vagina, but this usually presents as big masses. So there's abdominal enlargement. Minsan they're diagnosed late in the stage of the disease, and pagka na-diagnose siya late in the disease, these are the ones which may affect them yung eating nila. So sometimes they're so cachectic, they lose appetite already. And it involves a lot of organs, yung adjacent organs doon for ovarian cancer. Ang PCOS is mabait lang, benign ng PCOS, but it causes menstrual problems. That's why it becomes
Yes.
a problem for our young women.
Alright, we're now sustaining our learning as we will delve deeper into cervical cancer. So for the first one is, why is HPV testing important in diagnosing cervical cancer?
HPV DNA typing, that's the test that we're doing, gives us an insight of the type of virus that's present in the specimen that was collected. So it gives us an idea whether what is present in the cervix from the smears that were taken from the patient contains the high-risk type or the low-risk type of HPV. So if we recognize the high-risk type of cancers, we're able to screen our patients already that these are the ones whom we have to watch out for, whom we have to take care of so that they don't develop into cervical cancer. Or for all we know, because they have the high-risk type, meron na rin sila ng cancer ng cervix.
Oh, so with that po, how is HPV testing different from pap smear po?
HPV DNA typing is taken from the cervix also, but you get samples from the cervix and you put it in a medium. It's a liquid medium. You swirl the specimen there in the liquid medium, and then it has to undergo testing na. May procedures that they undergo so that you'll be able to filter the viruses from that particular HPV DNA testing. While in the pap smear, they will just tell you if there's an abnormal lesion that's noted, and then you will proceed to another test to confirm whether this is cancer or not.
Great po. So how does radiation therapy help treat cervical cancer?
For all the stages of cervical cancer, our treatment is radiotherapy with concurrent chemotherapy. But there are instances wherein it's early stage lang, so we can do surgery for our patients, particularly if they're young, they're still desirous of maintaining yung sexual functions nila and all, but not necessarily their capabilities of getting pregnant already. But if the patient has a very small lesion, medyo mabait na klase yung cervical cancer niya, we can do some very conservative surgery so we can preserve her fertility status. But generally, radiation takes care of the cervical cancer. So it shrinks, no, it reduces the size, it kills the cancer cells through radiation with the help of chemotherapy so that it becomes more sensitive to the radiation.
With that po, Doc, why is practicing safe sex important in preventing cervical cancer?
Because it's sexually transmitted.
Yes.
It's a sexually transmitted disease. That's why it's important that our patients practice, number one, a very monogamous relationship. Not just making use of contraception, but to make it a monogamous. Sabi nga namin, I give my lectures, I always tell my audience to practice KISS. KISS is to keep it simple and safe. Okay, so you maintain a monogamous relationship so you don't risk yourself from having or contacting the virus from several contacts from people who may contribute to the population of the virus to cause the cancer in the system.
With that po, Doc, what can happen if cervical cancer is not detected early?
If it's not detected early, so it can cause the symptoms that we mentioned kanina. May bleeding pag nagko-contact. There can also be some malodorous discharge that can come out. Eventually, it affects the other organs, so it can cause pain. It can basically affect our women because a lot of our women now are working. They belong to the working population. About 50% of them are working already. And this entails having to absent themselves from work. And having not to work means less economy for the household.
Yes.
So it becomes a problem also socially in the community.
Speaking of socially po, how can communities improve access to screening and vaccination?
Okay, that's a good question. Now that we're celebrating Cervical Cancer Awareness Month next month, now we do some screening procedures for our patients. We try to go as far north as we can or as far south as we can also. We have some activities, we have some programs wherein we can teach our patients on how the value of screening to prevent cervical cancer. We have some screening procedures that we do. You mentioned about pap smear kanina and the HPV DNA typing.
Yes.
HPV DNA typing is number one yan as a screening tool. Top priority kasi it gives you exactly the virus that's present, but it's very costly. okay. Yung pap smear naman, kailangan may pathologist ka who's there to read on the results. So in those areas where the HPV DNA typing may not be available because of the cost, there's no pathologist who will read on the results, we can resort to some screening methods like visual inspection with acetic acid or visual inspection with glucose iodine, which means we apply acetic acid or suka over the cervix, and the areas where we see that there are abnormalities, then that's where we usually recommend doing the biopsy.
And with that, we will now proceed to quick fix or crisis, a way to dissect whether an online health hack clicks or is just a glitch for topics about cervical cancer. Frequent use of feminine wash increases risk to cervical cancer.
Crisis. That's not true. It doesn't have a bearing whether you use feminine washes. Sometimes there's some irritants that are, because sometimes you want to make it really perfumed or nice smelling, the feminine
Yes.
washes. So the more chemicals are there to keep that particular goal or objective of keeping it really fragrant smelling. So that kind of irritates sometimes. But you only wash naman the outer area.
Yes.
You don't use it to wash the inner area. So it doesn't have a bearing. It doesn't increase the chance for somebody to develop cervical cancer.
HPV vaccination is the best preventive measure for cervical cancer.
That's a quick fix.
Okay.
So we advocate giving the HPV vaccine because it increases the body's autoimmune or the immune response. We develop antibodies against these viruses which causes cancer. However, this should not prevent the women out there who have received the HPV vaccine to have themselves screened pa rin for cancer, for the pre-malignant lesions. So it doesn't mean that because she received the HPV vaccine, she would not seek consult for cytology or pre-malignant screening.
Condoms and contraceptives prevent HPV transmission and thereby cervical cancer as well. Is it a quick fix or crisis?
But dalawa siguro. Because quick fix probably for the condoms because it's we mentioned that it's sexually transmitted.
Yes.
And having a barrier method, we're in a Catholic institution, but this is for the prevention of the STIs, but
Yes.
not because of contraception.
Yes.
So we're using it as a form of protecting them for the transmission of the HPV virus. I mentioned a while ago that one of the risk factors is oral contraceptive pills. Because if somebody's using oral contraceptive pills, it increases the chance for a particular type of cancer also, yung tinatawag naming adenocarcinoma, to come out. No? So it increases. Plus, when somebody's using OCPs, the hormonal stimulation does not get her pregnant, and that also does not prevent her from having sexual contact here and there. Okay. Our problem with cervical cancer is that it's sexually transmitted, so the more sexual contact that's there, the more chance is there for the virus to be transmitted. So if you're not scared about getting pregnant because you're using the pill, then probably pwedeng may increasing chance of transmitting the disease.
Physical contact to the female reproductive organ causes tearing and thereby increases risk to cervical cancer.
Reproductive area, referring to the cervix here, it's so difficult to reach the cervix, for somebody to reach the cervix. Probably what they meant here was just outside, the external part lang, so it doesn't affect. Because it has to be that the virus gets into the cervix. So crisis pa na yun. So it has to be the virus getting into the cervix, burrowing into the cervix, but not
like
because
close contact.
close contact.
Yes.
Kaya nga sexual intercourse because nandun siya sa male organ and then it gets introduced there.
Avoiding pregnancies ultimately reduces risk to cervical cancer. Is it a quick fix or crisis po?
Avoiding pregnancy will ultimately, the bottom line is not about her getting pregnant, but it's how you make the pregnancy happen. So even if she's avoiding, so ganyan siya. So even if you're trying to avoid getting pregnant because you're using contraception, For some, that doesn't fix the problem.
Yes.
Because it's a sexual contact that's involved. It's a transmission through sexual intercourse that's the problem that's causing the HPVs to be introduced into the system, causing the cancer.
Alright, so thank you so much, Doc Jo, for participating for today's episode. And with that, do you have any closing remarks with regards our topic for today? Any advocacies that you have for cervical cancer awareness po?
Cervical cancer awareness is this month, this coming month. We celebrate it on May 23 while doing a nationwide visual inspection with acetic acid or screening for cervical cancer. Alamin, iwasan, labanan natin ng cervical cancer because it's preventable. We just need to have our women screened for the disease and let them avail of the vaccine if they can afford it, and always have themselves checked by their gynecologist. At the UST Hospital, we have our Benavides Cancer Institute, wherein we cater to all of our patients with different kinds of cancer. We have radiation facilities, chemotherapy facilities that we can that we can offer our patients so that they can be treated with their cancers.
So today we have learned about what cervical cancer is and the simple but life-saving steps women can take. By sharing information, we have shown how communities play in supporting women's health. For this episode, reminded us that these conversations are not just information. This is also about empowering individuals through supporting one another in building a healthier future for everyone. Once again, this is Andre Isabel Velasquez, your host for today's episode of Lifeline, where we improve our lives by feeding our minds.